Hi there. Thank you for joining us this afternoon. And just wanted to introduce myself. I'm Dr. Mark Roach. I'm a board certified pediatrician in the Orlando area with AdventHealth for Children, specifically in Lake Mary. Just give you a little background about myself. I'm a Florida native. I went to the University of Florida for 4 years for my bachelor's degree. Got my medical degree at the Eastern Virginia Medical School and did my residency at MUSC in Charleston. I've been in the area now for 20 years as a pediatrician. So basically, I'm here to answer any questions that you may have this morning. I know that finding a pediatrician can be overwhelming, and a lot of times it breeds a lot of anxiety in expectant moms. And so I'm here to just kind of walk you through the process of tackling that uh, being able to find that pediatrician that works best for you and your family. So I want to go ahead and say, should you find a pediatrician? The best time to find a pediatrician most likely is during your pregnancy, typically around 24 to 28 weeks of pregnancy. And people ask, what's the best way to find one? A lot of times it's word of mouth. It's people that you know or friends that may be able to point you in that direction. Want to state here that, at AdventHealth Women and Children's, we do also have advocacy for moms that can help you make that decision for you to find a pediatrician that is local to you and that will best serve your needs going forward. Also for moms who already have a pediatrician who may not be happy with access to their pediatrician. Sometimes the hours can be somewhat limited. AdventHealth can also help finding those pediatricians that may have extended hours for your, for your child. Definitely would recommend seeing a pediatrician just because a pediatrician is more in tune with your child, and that's what their specialty is. Some people can see family doctors, and family doctors do have some pediatric training. They also see adults as well. And so their perspective is a little bit more broad, whereas with pediatricians, we're most focused on little ones, especially those early stages, those early times when they're going to be seeing their pediatrician quite often. And in fact, most of the time for a well child in the first year of life, you're going to see your pediatrician probably about 5 to 6 times a year for just routine well visits, and that doesn't even include possible sick visits that your child may encounter during that first year. Do we have any questions out there? Going on to trying to find that pediatrician. Obviously, like I said before, friends, co-workers can help you. Also, doing your own research could be beneficial. Like I said, at AdventHealth for Children, we do have free navigation services for women and children, and there are nurses that are specifically trained to help you with finding a good pediatrician, and also for services that some pediatric offices offer, like we offer lactation consultants at our office. We have specifically trained nurse practitioners as well as physicians that help with lactation, because that may be one of the things that expectant moms are looking forward to, is to breastfeed their child, which we recommend is the best way to go. Obviously, in certain circumstances, that may not work out for some moms, and obviously we try to help you the best we can, and know that obviously formula is a backup for those situations. But we like to help moms that are excited about breastfeeding their child and to work with them and helping them in that endeavor. Yes, and so one of the questions that we have is, what questions should you ask your pediatrician? Should you meet in person or virtual? Obviously, during the COVID times right now, I've been doing more virtual visits. In person is great when you can. If you can mask and social distancing, that's fine. But virtual is another possibility that will work quite well. One of the questions I usually tell parents is to ask, is that pediatrician board certified? So they're board certified pediatrician. That's important. Obviously, does their practice follow the American Academy of Pediatric guidelines as far as vaccination schedules? That's also very important, because in pediatrics, basically what we try to do is to practice preventive care. You want to make sure your child is healthy and to avoid possibilities that they may acquire infections that may be harmful to their health. So that's one of the questions that I would ask. Ask how their after hours work. So when it's after hours, who will you speak to when it's 2 o'clock in the morning and you have a fussy baby or a baby with a fever? What is their protocol for getting in contact with the pediatrician on call? In our practice, we take our own calls. So if you call after hours, you will get myself or my 7 or 8 other partners that will talk directly to you if you have that issue come up. I have another question about a parent that suspects their child has autism. Should they see their pediatrician or see a specialist? Obviously, I would start with your pediatrician. Your pediatrician is kind of like your quarterback for your child's care. They're the one that coordinate everything. And so we do testing, for autism. But obviously, if we feel that your child meets that criteria for autism, getting in with a specialist can be helpful. But sometimes those wait times to get into those specialists can be quite long sometimes. So if we suspect a diagnosis of autism in your child, we will be definitely able to get you resources so your child can start their early interventions, which are very beneficial for children that have autism. So that's a very good question. And, glad to hear, I'm offering you my opinion on the subject there. I was stating earlier when to look for a pediatrician. Earlier the better. Typically, it's never too late to find one. Definitely before you deliver is probably the latest. So you have a follow-up appointment to go to. So a lot of times, you're too busy. You're busy trying to deliver the child, and a lot of things can be overlooked. But getting a pediatrician early can be helpful, especially because once your baby's delivered, the baby is discharged, you want to have appropriate follow-up for that baby. Usually we recommend in the first 24 to 48 hours to get in with your pediatrician. So the earlier the better. Your OBGYN can be a useful source as well for helping to find a pediatrician, or just kind of doing your own research and get to talking to pediatricians, try to make a meet and greet with the pediatrician. Our practice, we're doing it virtual right now because of COVID, but we're used to doing it in person. So that's a good question. I would say once you are starting to get to the hospital to deliver, that's probably the latest you want to get your pediatrician picked out. Some of the questions that parents, will have is, what to expect when visiting your pediatrician. When your baby is born, obviously you're going to have follow-up. Usually we like to see the baby in the first 3 to 4 day of life to make sure that the baby's feeding well, they're avoiding, they're stooling, mom's breast milk is coming in, see if any moms have any questions about their child, how they're, if they're overly fussy or they're, there's some discontent, or, mom's not sure how, if baby is having trouble soothing. We want to answer any of those questions that mom may have. Typically, there's questions about circumcisions, especially if it's a male child. Obviously, we offer that service to be done. That's totally up to the parents. If that is their wish, we're happy to offer that service. It's not required. It's totally a parental choice. One of the questions is about flexible vaccine schedules. Typically, we go by the American Academy of Pediatric guidelines, and by using those guidelines, that is probably the most effective way to vaccinate your child. 2 of the vaccinations that they get at 2 months of age are for bacterial meningitis. And so we believe in not delaying those vaccines, because anytime you delay vaccines, you're actually opening up a gap where the child is not protected against those potentially fatal illnesses. So there is one vaccination schedule that we offer to parents that basically allows them to get 1 or 2 shots at one visit and then come back a week or 2 weeks later to get the other shots. And the reason we do that is more of an offering to parents that are a little bit skeptical or worried about vaccines. However, it's not borne out in research. So basically, my recommendation is to get the vaccines on schedule. The most shots that they get at one visit is 3 vaccines, 3 shots, 1 oral. One of them is Pediatrician, which is DTP, polio, and Hep B. That's one vaccine. The other two are Haemophilus influenza B vaccine for meningitis and pneumococcal vaccine for meningitis. The oral vaccine is Rototec, which is a viral illness that causes sometimes vomiting, diarrhea, and dehydration, sometimes causing hospitalization in babies. So the reason the vaccine schedule was made its way is to prevent any gaps in the child being protected. So there you go. Good question. So a lot of things that we do as pediatricians is basically toning down parental anxiety. We're there to reassure parents. 90% of what I do is reassure parents that their baby is doing well and to reassure them that their babies are healthy. Occasionally there can be some issues that come up, but most of the time it's to reassure parents that your baby is growing well, developing well, and making sure they have those milestones. That's why we have those visits. We check them. We watch their growth very carefully. We also check for head circumference, their height, their weight, making sure they're following their percentiles. It's very important to watch the growth of the baby and also the development to make sure at 2 months they're smiling and maybe cooing, at 4 months that they're having a laugh, at 6 months they're starting to sit up, at 9 months they may be pulling to stand or even starting to take a few steps with assistance. So these are things that we do is to make sure the babies are developing well and to make sure they're meeting those milestones. And if they're not, that we're getting the appropriate referral or care that is necessary going forward. Also, their vaccination is very important. We're giving those vaccines again at 2 months, 4 months, 6 months, and 9 months, and also a year, 15 months, 18 months, and 2 years. You have another question? Yes. One of the questions is, do the pediatricians go to hospitals at birth? At our practice, we do go to AdventHealth Altamont. There are other hospitals as well. Some practices only use hospitalists so that their pediatricians are in-house. And if that's the case, they see the pediatrician that's in the hospital. And then once they're discharged, they can follow up with their own pediatrician. So if you are our patient and you were born at AdventHealth Altamont, we would see you there at the hospital. So we kind of do both. We get patients from other hospitals that we don't round at, and we see them, once they're deemed to be healthy and discharged. We like to see them within 24 to 48 hours after discharge. Yeah, as far as coverage for pediatrics, we take all the major insurance companies out there, and so yes, one of the main ones are Blue Cross Blue Shield or Aetna or Cigna. We take all the major insurance providers. Occasionally, there may be some Medicaid offerings like Healthy Kids that may be taken by some pediatricians as well. And going back to some of the questions to ask your pediatrician too, vaccines are one of them. Walk-in visits. As far as charging fees for after-hours calls, things like that, we do not do that. It's kind of our service. One of the questions that came up is about circumcisions again, about doing a circumcision or not doing a circumcision. As far as my personal opinion as far as circumcision, it's individual. I see plenty of kids that do not get circumcised, they do well. What are the advantages of getting a circumcision? It's easier to take care of. There's some data that shows that in non-industrialized countries that it can sometimes limit certain penile cancers and urinary tract infections. However, in most industrial countries that have good hygiene practices, children that don't get circumcised can also be, perfectly fine and not have any health problems. There has been occasions in my experience where a child hasn't been circumcised, and because of a tight foreskin, they've had urinary tract infection, and so that child had to be circumcised later. I would say that's the rare case of it. I've also had children that become teenagers that weren't happy with not being circumcised and decided to get us circumcised as an adolescent. So I would say that's not the norm. So again, it's a parental choice. It's a safe procedure. Like I said, we do it in the office. It takes about 5 minutes to do the procedure. Preparation's about 30 minutes. So if people are apprehensive about doing, circumcision, it is a very, very safe procedure. Again, it is parental choice, and plenty of parents either decide to do it or do not decide to do it. Okay, I have another question: is when visitors can come see the baby at home? Again, that's also up to the parents. I would say that because in the first 2 months the baby's not vaccinated, that probably, except for close family, I would say probably after 2 months of age. Typically before the COVID pandemic, I was recommending people wanted to go out with their child and at least have those first few vaccines, because that is very protective. Especially one of them is pertussis. Some of you ladies may have gotten your whooping cough vaccine or pertussis vaccine through the third trimester of your pregnancy, which is a good idea because that can be transferred to your baby. If you have like a slight cough, you may think it's just a mild cold, but whooping cough in adults can be very mild, but to the baby can be quite severe and cause hospitalization or even death. So usually that first 2 months is kind of what I like to tell parents, just to be cautious, especially around, having neighbors or a bunch of friends coming over. Another good questions come up is, when should I worry about a fever? I always tell parents a fever, in which we consider 100.5 degree, 100.5, not 105, but 100.5 degree temperature, rectal temperature, is considered an emergency, especially for the first 4 weeks. So in that case, if your baby is under 1 month or under and has a temperature of 100.5, you should definitely call your pediatrician. Do not treat with Tylenol or try to treat those symptoms at home, because it can be a serious issue, and an infectious disease of some sort, or urinary tract infection that can become a kidney infection, or even bacterial meningitis. So those are very important. As far as temperature, even a temperature up to 2 months of age, I still would consider consult your pediatrician. But definitely in that first 1 month phase, if you get a temperature, baby feels warm, baby's not feeding as well as he or she should, not drinking well, decreased urine output, those are definitely warning signs that something may be going on. So those are not just fever, but also how the baby's acting, how the baby's feeding, urination output. Another question that we have. Okay, another question coming in is to see if we're in Central Florida. I'm in the Lake Mary area, so I'm just north of Orlando, about 20 minutes north on I-4 off Lake Mary Boulevard. And so, like I said, that's where my office is located. That's where my main hub is, and I'm happy to see any of you out there in the cyber world tuning in today. So, other questions that you may have. Because of COVID and everything, we have modified things, and I would say in our practice, we have had people, we don't have a waiting room now. So we basically have a waiting room where you call in from your vehicle. And so what we do is we try to do that so you're not waiting in our waiting room with people that may have certain infectious disease. We also reserve a few appointments in the afternoon, so only babies, probably less than 4 months old, are coming in from 1:30 to 2:30 in the afternoon. So now, because of COVID, things have changed, so we really don't have a waiting room. We kind of have people waiting in their cars and then kind of being brought back as we see fit. Another question that's come up is, dry skin in babies. Eczema is very typical. It's not a life-threatening condition typically as far as dry skin, but it can be very irritable to the baby and cause rashes to appear. It can make baby uncomfortable, or they're scratching at their skin, difficulty sleeping sometimes. So that's eczema. So a lot of times, mild cases, we may recommend moisturizing the skin with a hypoallergenic moisturizer, usually 2 to 3 times a day. A lot of times we may check to see if there's anything that could be irritating the baby's skin, such as a lotion that may have a fragrance, lavender, that can cause that. Sometimes baby soaps that have some ingredients that may be fragrance, or a dye can be irritating the skin. Sometimes what you wash your baby's clothes in. So a lot of times we may recommend Draft or All Clear, that's hypoallergenic detergent, because baby skins can be so sensitive. So those are some of the things that we should that we look into. Again, lots of questions coming in. How many clothing layers for baby in the summer? Well, we live in Florida, so typically in the summertime, very little, to be honest with you. A lot of times just the onesie, diaper is sufficient most times. Typically, you don't want any bedding or materials in your baby's crib, except for the first few weeks. You may be swaddling your baby with a really tight swaddle. That's okay, but you definitely don't want to have any stuffed animals or pillows or anything like that. So, it's just what you feel comfortable with. Babies that are cold will typically let you know. They're usually uncomfortable. They usually cry if they're not uncomfortable. So typically you can kind of, take your cues from them. A lot of times I find over bundling of babies, especially in Florida, we don't get, in the summer we're pretty hot, and most people's houses are probably mid-75. So definitely just a sleeper is probably fine. You don't have to put several layers of clothing. Usually one layer of clothing is sufficient. If your baby is comfortable and sleeping calmly like that, they're usually okay. If they're cold, their extremities may start to get a little bit cool. They're definitely not going to be comfortable. They may be fussy or crying if they're a little bit cool. And then you may be able to add another layer, depending on how the internal temperature of your house is. It's a good question. I asked if the baby has a seizure, should they go to the ER or go to their pediatrician? It all depends. A lot of times, they can be very scary. So for most of your parents, when the baby's having a seizure, they're most likely going to call 911. And it's never a bad idea to do that in that case. Most cases of seizures in babies can be febrile seizures. And typically we say, if a seizure is less than 2 or 3 minutes to a parent, that's going to seem like a lifetime, then you're probably okay, either calling your pediatrician and have them come in for a visit. Obviously, if it's a seizure lasts more than a couple of minutes, in that case, it's always an emergency, regardless of the cause. I would definitely call 911 in that case. Oh, it's almost 12:25. Do we still have another minute? Okay, great. Any more questions that you guys may have? We still got another minute or so. Thank you for definitely reaching out today. There's another question that's come in with COVID. Can out-of-state residency baby? Honestly, most of the states, are probably similar. Some of them are different as far as their COVID impact. It's definitely a judgment call, on their part. People are social distancing. These are family members that that are coming out of state. It's a judgment call. Obviously, COVID is in every one of the states. It's not like they're coming from a place that has, they could be coming from a place that has higher incidence of COVID, obviously, but every state has COVID in it. It depends on the community, whether in a inner city or that has lots of cases, or they're out in a rural country. But basically, it's dependent on how they've been socially distanced, what's your exposure to COVID. Again, it's your own judgment call. It's never a bad idea, to social distance when they're visiting. Obviously, this close family or relatives, it's totally up to you. You make your best judgment. I would say that COVID's going to be with us for a long period of time, even as people are starting to get vaccinated. So I think there's ways that people can visit safely and do it with the right precautions. If you have any further questions, feel free to visit us at the AdventHealth booth. There are health navigators there to help you. Thank you so much for tuning in today, and we look forward to meeting with you and seeing how we can help you. So thanks again. I'm going to sign off for now. Thank you.